At the age of 17, I became a family caregiver to my grandmother who lived about 30 minutes away from my family's home. Partially because my mother was the eldest daughter, and this is typically a role that the eldest daughter fills, but also because I had just gotten my driver's license and I really felt the need to get out of the house and hit the road and go anywhere. So I would go down to visit my grandmother weekly, multiple times a week. And even as she started to fall ill, visiting dialysis multiple times a week, and not exactly cutting the rug the way that she used to, she refused to leave her home. Like many other older adults across America, she was attached to the place that she had worked for. She was attached to the place where she had now spent the majority of her life. She was in love with that place, regardless of where it was or what it looked like to other people. You see, she lived in a neighborhood that was predominantly Black, characterized by low income and some middle income families, in this small little cul-de-sac that oftentimes on a weekly or a daily basis saw police presence. She slept with a machete near her bed, but I don't really think that this is because she feared for her safety, as she was extremely respected. I think it was really because sometimes grandmas just do weird things. But nevertheless, she didn't want to leave. And this began my time with my grandmother. And also, unbeknownst to me at that moment, it began my research interest. And now today, I study older adults who are aging within the community and utilizing home and community-based services. I study the neighborhoods in which they live in, and I study the racial, ethnic, and socioeconomic disparities that may be associated with the services that they use and the neighborhoods that they live in. Researchers now know that the zip code is a greater determinant of your health than the actual healthcare services that you use. But see, I believe that this is simply because the healthcare services that we actually have access to are characterized by the zip codes that we live in. Now, this isn't a belief that I've just snatched from the sky somewhere. This is proven throughout research. From secondary data analysis, we see that nursing homes, hospitals, and even physicians serve based on the neighborhoods that are around them. We're seeing that higher quality nursing homes and higher quality hospitals tend to be concentrated in more privileged areas. But what we don't know is anything about home health. We don't know what's available, what's truly accessible to those people who live in different types of neighborhoods. Yearly, the Centers for Medicare and Medicaid Services rates home health agencies based on their quality the same way that we would rate our favorite restaurant on Google. No, not the $1 sign to $3 sign, not the I can afford this on my own and I have to wait for my parents to come to town, but the 1 to 5 stars, where 5 stars represents the highest possible quality. It represents that those users have the best possible outcomes. And so what I can see in my research and what the data starts to show at this point is that the same is true for home health agencies. Our highest quality home health agencies are less likely to serve in predominantly Black and low-income neighborhoods. So now what does this say about health equity for our most vulnerable population? Honestly, populations that are sometimes triply or doubly vulnerable based on not only their age, but their socioeconomic position, as well as their race and ethnicity. What does this say about the impact of policy today? I'm passionate about my research, and my research matters because the goal of my research is to help policymakers figure out how to incentivize home health agencies to serve in underserved areas. My research matters because data-driven policy is maybe one of the best ways to decrease health disparities and increase equitable care for all populations, regardless of what you look like, where you come from, what your neighborhood looks like. I am passionate about my research because I don't believe that historically and socially disadvantaged and marginalized communities should be further disadvantaged by policies and practices of our healthcare system. I'm passionate about my work because I believe that every older adult deserves to age with autonomy and dignity wherever it is they want to age, whether that be in their home or an assisted living facility. I'm also passionate about my research because since I started my talk, each of us in this room have aged about 5 minutes. So my research not only includes my grandmother, but it includes each of you. Thank you.